Thanks for having me. It's great to be able to participate this evening. I'm sorry I'm not able to be there in Greece in person, not only to talk, but to give you a live demo of our robot. So what I'd like to do over the next 15 to 20 minutes is tell you two stories. So one is going to be historical, kind of recent history of research I've done over the last dozen years, which has led to the starting of our company. And the second, a more broad story to build on that, stories around what I think it takes in the recent past and the near future to commercialize academic research in interactive robots. So my company is Intuitive Automata. This is the first product that we have coming to market. As you've heard, this is our autumn weight loss coach. But let me start off by going back to some simpler robots that I used a little over a decade ago when I started at the Media Lab at MIT. The robot that you see on the left here is obviously a very simple robot, a pair of eyes. And what you see on the right is an animated version of this. So in 2001, 2002, when I started working in interactive robots, what I found at that time was that we knew a little bit about what was happening when people were interacting with robots, but not a lot. So my background at that point, I'd been working at the intersection of healthcare and technology for about 4 or 5 years. Working with very different technology before this, looking at things embedded in the home for what we now call aging in place, ways to allow an elderly person to live at home longer rather than move into an assisted living facility or with a family member. And when I went back to graduate school, I wanted to stay in the broad area of technology and healthcare, but starting to look at a very new technology. So I really come at this from the angle of solving problems, and I wanted to understand, based on the few interactions I'd seen with interactive robots that had been created by that point in time, what was happening in terms of us as people as we interact with these. So I carried out a series of experiments with several different robots, a few hundred different research subjects over a couple of years. So this was one of them, the simplest robot. We built on that. This was a slightly more complex robot, although you can see that it's still fairly simple. This was Mel, the robotic penguin at Mitsubishi Electric Research Labs, up to this robot here, Leonardo. So Leo is a very complex robot, around 70 degrees of freedom, and roughly half of those motors, about 35, are in his face, making him very expressive, nearly as expressive in emotion as you or I. And across all of these, I'll go back to the picture of the simplest one here. Across all of these, what I was looking at was trying to understand, again, the psychology of what happens when we interact with these. And over the course of these studies, I found two major differences. So one has to do with engagement. When I put someone in front of a robot, and most of these initial studies happened in a laboratory setting, people were more engaged with interacting with the robot. And that's not particularly surprising. At first there's definitely a novelty factor, particularly if we think back 10 or 11 years. Not many of us had had the opportunity to interact with a robot at that point. And what we saw, though, that was more interesting than this initial engagement was that over periods of time, so some of these studies happened in one day, some of these studies happened over weeks or months, exposing people to these robots or the characters on the screen, that engagement continues to last for much longer with the physical robot versus the character on the screen. So that was one difference, and I'll come back to it in just a minute. The other thing that we saw was when we were trying to convey information to people, and this might be textbook information, math, science, geography, it might be health-related information. As it turns out, it doesn't matter what the information is, but when it's coming from the physical character, it's seen as more credible and more informative. The character itself is seen as more credible and more trustworthy. So people tend to believe the information coming from the physical robot versus hearing the same thing from an identical looking character on a screen. Now, as it turns out, this parallels exactly what we know about face-to-face versus any sort of mediated interaction. We would have a different experience if I were able to be there with you in Greece, face-to-face, giving this presentation, have a robot maybe next to me that you could see live. What we've learned over decades of studying this is that we tend to trust other people more, believe them more, develop a deeper rapport with them when we can have a face-to-face versus any sort of mediated interaction. And what I found is this carries over very strongly into technology, where interacting with a physical robot is much more like that face-to-face interaction versus interacting with a character on the screen, which is more like the mediated interaction. So over the course of my master's degree, I understood this. When I started my PhD, I was looking for the practical healthcare applications of this. And the broad area where this seems to be interesting and effective is that of behavior change. So behavior change is really about convincing me to do something, but more importantly, helping me to stick with it over a long period of time. And that's the particular set of things where I found an interactive robot could be particularly effective. So building on that, I ended up building this robot here. This was the early version of what has become the Autumn product that we're commercializing now as a company. But I spent several years looking at deeper into the psychology of behavior change and how this could be applied to interactive robots. And this culminated in a couple of years of work at across town from MIT at Boston University Medical Center, where they had one of the leading clinical weight loss clinics in the United States and indeed in the world. I spent a couple of years there initially seeing patients, and the end of that work was applying this model using their behavior change and weight loss theories and implementing it on the robot that you see here. So this is a robot that was built about 7 years ago, built by hand by me in the shops in the basement of the Media Lab. So fairly rough in terms of design. But what we did with this was a randomized controlled medical trial at Boston Medical to look at the efficacy of engaging people over time using this behavior change platform. And what we saw is that indeed this was extremely effective. I won't go into the details of the study today, but happy to talk about it maybe in the panel discussion later. But what we did was a controlled trial where we had 45 people who were randomly assigned into one of three conditions. People either received one of these robots that you see here, or they received a computer running the exact same software, same touchscreen interface as you can see on the front of that robot. And the third group of people received what is still today's standard of care, the paper log, and asked to write down how much they were eating and exercising each day. So over all of these groups, what we were trying to do was look at how long we could engage a person. And our baseline was knowledge that the average diet or weight loss program now lasts about 3.5 weeks with very little standard deviation. And indeed, this is indicative of a lot of behavior change. We as people are great at making changes, but absolutely terrible at sticking with them. So this was simply providing people with a coach to help them remain engaged with what they were trying to do. So as I just said, the average diet's about 3.5 weeks. So we designed the study to be 6 weeks long with no human intervention during the study. What we saw at the end was that people who had the paper log, so again, today's standard of care, used it for about 3.5 weeks on average. People with the computer and the software that was running the robot or the computer adapted to each person, so no two conversations were alike, helped to automate tracking what they were doing each day in terms of eating, exercise, and weight, and giving customized feedback and advice to each person. So people with the computer, we found that that made a slight difference. They used it about a week longer on average, 4.5 weeks versus 3.5. And as I said, this was a 6 weeks long study. When we called people at the end of the study to make an appointment for follow-up and go to pick up their robot computer paper log so we could get the data back, we saw immediate differences in making those calls in that people with the paper log or the computer pulled out their calendars or their diaries and we found the date for the follow-up call. Whereas people who had the robot started negotiating with me. So they were saying, can I just use it a few weeks longer? How about one more month? She's really become like a friend to me. So what we saw at the end of the study was that people with the robot used it on average 8 weeks, cut off by the end of the study. So a highly significant difference. So overall, what that showed, and other work has repeated since then, is that indeed using an interactive robot like this is very effective at engaging someone over a long period of time. So while we've started with weight loss, we see this as a much more broad behavior change platform. So the robot has evolved into the version that you see here. There are videos online as well. This is actually a fully working prototype that we're about to go into manufacturing with. And the goal of this platform that we've built is, again, to be able to engage someone and to help them remain engaged over time. For a number of reasons, having to do with market and regulation, the first thing that we're bringing to market, the first application, is our weight loss coach. But more broadly, we're looking across the healthcare spectrum, working on things around diabetes management, other chronic diseases, making sure someone takes their medication, or perhaps a companion for an elderly person at home. So I'm going to stop there talking about the specifics of the applications, and I want to talk a little more about the market opportunities for the next 5 minutes or so. So what we've created is a platform for long-term engagement. So the ability for a robot to actually create a relationship with a person. And again, this is built on psychological theories of relationship. So we're applying this to healthcare applications, but I think there are a lot of other places where these same theories can be applied, whether that's in companionship or entertainment or education or other opportunities I'm sure we have not thought of yet. And the core of this is really just delivering the right conversation at the right time. And for the reasons I've talked about, when we deliver this on an interactive robot, it's much more effective at long-term engagement versus doing the same thing, on my mobile phone or my tablet. Those just aren't as effective at the long-term engagement. And so, we're focused on the widespread healthcare conditions, but what I think that this shows is that there's a much more broad opportunity for interactive robots in the market today. So I'm going to skip that. But the challenge and the opportunity, so kind of transitioning now to talk about what it takes to bring this to market. The transition from academic research, where I need to build 10 or 15 or 20 of these to show that it might be effective, to scaling this up and delivering it to the market. The challenge is, almost by definition, a robotics company at this point in time is fairly small. We've heard examples this evening of a few companies that have grown beyond this, but there are scores of additional companies that are starting up and might be 2 or 3 or most 10, 20, 30 people trying to bring these to market. And so your challenge as a startup then is you have to do everything to get this product to market. And I think some of the key things that we have to concentrate on are obviously product development. What are we building? How does it solve the needs of a customer? And everything around what that product is, from defining it to delivering it. And then some additional challenges are customer acquisition. So of course, with any startup, finding the right customers is a challenge. But when you're creating a robot in general right now, you are creating a new market. And so the second and third points on this list have to do with that. You're finding those customers that not only are looking for a product like you have that solves their needs, but ones that are willing to kind of stick their neck out a little bit and try what is obviously a very new solution. That's something I've been working on for several years in my company. We've identified some health insurers, hospitals, and employers in the US that are willing to give this a try. But that's definitely been a big challenge for us. And related to that is understanding the market channels for a new product. So again, almost by definition, by creating a robotic startup right now, you are creating a product that doesn't necessarily fit into an existing space. So understanding what the right sales channels are can certainly be a challenge in how you get into those channels. You're not necessarily building a product that is just a little bit better than something else that's on the market, and so you go through the same channels as that product. You're really creating something new, and understanding what those channel opportunities are, I think, is something that we as a robotics industry are going to be doing a lot of in the next few years. The next is sort of an obvious challenge, and we've heard a little bit about this evening in terms of manufacturing. That one is definitely getting easier. I've seen an enormous change just in the 5 or 6 years I've been running Intuitive Automata, and I want to come back to that point again in just a moment. And as we've also heard this evening, funding remains a huge challenge. There is not a lot of money available for robotic startups, and that probably will not change until we see several companies taking off. So those of us who are kind of on the cutting edge of this and some of the first to bring products to market are exploring every different opportunity, from kind of traditional funding models in terms of VC or angel capital, but also government funding. My company has taken advantage of that in Hong Kong, where we do our design and development. We're looking at opportunities in the United States to do the same. Crowdfunding has certainly taken off in the last couple of years, and that's an opportunity for certain kinds of products. But this is going to continue to to be a challenge for robotic startups for the next few years. However, I think that the time has never been better to create a robotic product and bring it to market. Costs have dropped significantly really in the last 2 or 3 years. We've seen them going down quite a bit over the last 10 or 15 years, but in the last couple of years, the costs for prototyping and manufacturing have really changed drastically. And this is related to a couple of things. Actually, let me stay on this slide for a moment. This is related to a few different things. One, on the prototyping side, we've really seen an ability to start to prototype things much more quickly, largely related to 3D printing, but also because of some other manufacturing changes. We can iterate on a product design as we go through our development cycle for a much lower cost than we could even 6 or 7 years ago. So that's a significant upfront savings. And then in terms of longer term manufacturing, on the mechanical side, things are getting a little bit cheaper and a little bit easier. Those costs go down slowly. But I think one of the big things that we've seen, in our company, in building our Autumn coaches, and in a number of other robotics companies, is really the takeoff of mobile phones and tablets. So what that's done is driven down electronics costs immensely. We've seen the electronics costs that we've been putting in our robots over the last 4 years drop by about 80%. And that's an enormous difference. And I think that this is really going to impact our ability to build robots that can be sold at scale today and in the near future in an enormous way. So just kind of in closing, I think the opportunities are great right now for bringing robots into a lot of new application areas. And our approach as a company, my approach as a researcher before that, is really look for the problems that need to be solved and where this technology can be very effective. So starting with the challenges that people face, where there are markets that we can address with robots, I think is a great approach to looking at this. We've seen a lot of interest from around the world. We have quite a few pre-orders as we get ready to go into manufacturing the first of next year. And I think that there are a lot of additional opportunities that are going to open up in robotics over the coming years. So again, I appreciate the opportunity to participate tonight, and I look forward to interacting with the other speakers and answering your questions in a few minutes. Thank you.